Experience shows that opioid medications are safe and effective when used as prescribed. However, that doesn't mean that the decision to include opioids as part of your pain management program is a choice you can approach lightly or without thoroughly discussing the pros, the cons, the benefits, and the responsibilities with your healthcare provider. In fact, despite the fact that opioids are widely and frequently prescribed, there is still disagreement in the medical community as to whether or not opioids are an appropriate treatment for chronic pain. We call it the opioid controversy. But what it really is an ongoing dialogue about uncertainties and questions regarding opioid therapy that can only be answered by you and your healthcare provider.
I'd like to take a minute to talk about the controversy that surrounds opioids. So either you are a strong believer in opioids and their use, but there are other physicians who feel very strongly that they shouldn't be used at all. And the question is there a middle ground? And so the problem is, in this country today, the prescription drug abuse probably exceeds illicit drug use, which surprises a lot of people. There are deaths in this country from the improper use or overuse of opioids.
Recently, many people have probably heard about the controversy with regards to opioids, with some individuals saying they're very effective in treating pain, and with some individuals saying they should basically not be prescribed. And the truth's somewhere in the middle. And there's many individuals that benefit from opioid pain medications when they're used appropriately, both when there's an understanding from the healthcare provider and also the individual that's being treated with these medications, understanding the risks and benefits, and having realistic expectations of how much opioids may actually help you.
So the issue to me as a pain specialist is frankly not whether you're on an opioid, but your function. Is the drug I'm giving you making your life better without causing difficulties in your thinking and your ability to function? So if a patient comes into me and they're in bed 24 hours a day and they're on an opioid, then I'm asking myself, how am I helping you? Versus if I have someone who's in bed and I give them an opioid and now they're working, then I say, this seems to be working. This is a good thing.
There's also been controversies with chronic opioids causing, besides their pain-reducing effects, some side effects that affect the endocrine system, your testosterone. There's also some theories that high-dose opioids may actually make your body more sensitive to pain. And so, again, even though the opioids have been around for many years, we're still kind of struggling with understanding how it actually works and understanding how it may vary with patient to patient.
But the controversy around opioids is very complex. There are physicians that believe there's no limit to how much you can prescribe for someone. And as I've said, and as we say in the Consumer's Guide, there also is a belief among some people that they should be used sparingly at best. And the middle ground, which is always the sensible place, is to use opioids sparingly and carefully to the extent that they provide increased function without limiting the individual with unmanageable side effects.
To someone who's really just seeking relief from pain, some of these questions may seem abstract and far removed from day-to-day life. Few of us are qualified to answer them or even try. But for the purposes of making your own personal decision about pain therapy, what's important to understand is that we don't know everything there is to know about how opioids can help us, how they can hurt us, and how best to balance the good things they do with the problems they can create. The effectiveness of opioids varies from person to person. So do the side effects. So do things like proper dosage, tolerance, and dependence. Sometimes opioids become less effective over time. Sometimes they just stop working. And sometimes they do more harm than good. In short, there are no guarantees. But even just knowing that makes you better prepared to make a responsible, informed choice.